I'm very happy to be here today. A little correction, I'm not really working on bedside, but patient side. And the vision of future of health that we are all trying to describe and discover, I think what I want to point out today is that the patient for us is key. A little few words about the company. Ma Santé means my health in French. I know most of people here are French. But why Ma Santé and why did we create this company is, I think, important for us to share. I'm here with most of the company partners. Ma Santé started after I was working in a big American company called McKesson, and it's the largest, called it the largest drug dealer in the world. They're 16th biggest company in the world, and they were distributing medication in North America. And in the frame of that business, they were investing a lot of money to find out how to trace the medication, how to automate, how to put IT in there. And while doing that, well, there had to be software to be sold to the main medication users, hospitals. And in hospitals, well, we faced a lot of paper and a lot of people that were totally not ready for that. So it all started there to find a way to bring in a digital hospital, paperless environment, much more efficient way of working. And, well, I thought at that time that in 1 year or 2 years we would have a great solution, but it's 6 years later and we're still improving and discovering new opportunities. So the first slide here is really describing the core of the new business that we wanted to, or the future of a hospital, a paperless hospital that we wanted to describe. So it's about this meeting between a caregiver and a patient at the most critical moment. When you're in a hospital, most of the time it's not a good moment. And that relation, you can describe it on a psychological way, a different, on a clinical way as you want, but for a doctor or a nurse, it's a very touchy moment. So to bring in there a computer taking away paper is not that easy. So we had this prototype done at the time, and that was really to describe that if we put a computer, it has to be touch-based, it has to be easy to access, it has to be simple, and it has to make the caregiver comfortable with the fact that he's with the right patient and that he has all important data only and not too much. And that clearly at the time didn't exist at all. And today still we are not there. So how we try to landscape the future of the technologies we were seeking was very basic. It was traveling, looking at hospitals all over the world, and really looking and taking pictures, and try to describe what we see. I heard this today on a presentation, somebody saying it's not about changing doctors, it's about looking how they work. And I fully agree on that one. So this is a bit dark, but this, you wouldn't expect this to be in Singapore, in a hospital that was opened 2 years ago. So everybody believes in Singapore, they have a lot of money, there are a lot of technology, everything is perfect there. But, you know, I just take a picture and there, I take this picture and I look, I count 1, 2, 3, 4, 5, 6 nurses, but nobody's nursing. And that means for me that we are paying 6 nurses to do what? Write on papers so that they can put it in a computer or take it out of the computer, put it back on the paper. So for them, IT means more work and more problems. So here, if we have to have a good hacking health comp, I think this is important to keep in mind that whatever we are building, it has to be usable and make sense to the people that will use it. if you look at the outcome of working this way, while there are computers all over the place, very high-level software systems, look, the outcome. Nobody's able to consider it safe to work this way and be in the hospital that way. If you look at the patient, poor guy, he's alone, everybody's busy, and he doesn't know what's happening to him. So I think here, it's the main idea is how can we get the patient engaged, present, playing a role, playing a game in his own care, but get him out of this bed and not leave him alone there, not understanding what he has, probably very scared and really not aware of what he's eating. If I look at the technology part of the same hospital, and I go in the basement and I see how all of that is connected together, this is a real picture. I took it myself. And they tried to convince me that it's a reliable environment and that everything is working fine and that they paid a lot of millions euros to set it up. But I wouldn't risk my life based on that, or I am a different human race. They can maybe go in that hospital, but I don't feel safe there. So if we look a little bit at what we are trying to do with innovation, new technology, new systems, this is another picture I took in the hospital. Can you read it? In French. Il existe des patients qui ne veulent pas voir leur souffrance, d'autres ne veulent pas s'écouter, d'autres ne veulent pas se plaindre. And the hospital comment inside the hospital, nous, il nous faut l'évaluer dès l'admission et le noter dans le dossier de soins. So in English, we have patients that arrive and they are maybe scared to talk about their suffering, their situation. They don't want to complain. They don't want to talk about the pain, but the hospital's challenge and the system challenge is to capture that information and put it in a system that can be shared. So for me here, it's a big turn. So we translate a need, a situation, to go into new technology, new systems, and work in collaboration. So then the next step is, first moment in the future, we are in the hospital now, and it's considered this way. New situation. There's a doctor and a nurse and a patient working together on the patient situation. The patient is sharing his emotion, his situation, is validating what he understands, doesn't understand. And here you can easily understand that whatever is going to be on that terminal can be a lot of things. Especially if we add the nice systems of our partner iHealth, or what Uwe just described earlier, vital signs collection, 24 hours a day on a continuous flow. Then you can start animating the whole stay and engage the patient and give him other technology systems where he can really coach himself and understand where he's going. So this is really important to really understand that this can drive us really to a different situation. But again, it's important, I think, to keep focus on working together. And I really like the idea of the Hacking Health Camp, because working together and see if all of this is true, all that we can add as information system coaching, and think, what do we want to share with the patient? What does the patient need to know? What can we have as a better outcome than a situation of today? Our work for a few years and our vision today is really that there's a lot to do, and we need a lot of people to work together, I think, to really take this opportunity to have a paperless patient and a paperless environment around the patient. So this drives me to also a subject where we were talking on the previous presentation about financing, about money. to take papers away of a hospital needs to add a lot of computers in a hospital. So there's also a business model to find. There's also a way to finance it. And that also has to be a continuous flow, because I'm sure in this room we can get a lot of ideas to improve this, but the immediate next need is finance it. So a new business model here, I think, is key also in the future of health. But if we look at new pictures and new environment that we developed or simulate and work on, every time, anywhere in the world, so this was in Singapore, we put the situation in place, and immediately the doctor and the nurse, they like it, they love it, and they think this is the way we should work. I was recently in Saudi Arabia, in Australia, any place that we go in the total different environment, this makes everybody agreeing on, yeah, we are the whole day digital. Why, when we're in the hospital, we should be disconnected? Why can I not know my situation, what I can do? It's not fair. So here, everybody is happy. So the outcome is really that the patient gets out of a situation where it's today considered the most underutilized resource in the world. I mean, patients today are not used for healthcare. So also the ergonomics for caregivers improves the environment. But really those new situations, I think, are very, very interesting and very much helping for future development. So the really ultimate outcome, I think that you're much faster out of the hospital, back on sport, healthy life, and that's really what I think in this Hacking Health Camp we should target, is to see how this is possible. I think that if I have a minute left, an image of working on healthcare that I keep having in my head all the time is a class that at university in Rotterdam, and a business school, there was a teacher always explaining system, information system, working together, didn't make sense. And Holland, you know, very good in football. So I said, system, I'll explain to you. 11 players, 11 players. That's football. They have the same rules, they have the same number of people, same skills, but one of them may win. What's the difference? Who is going to win? The best player, no, the best. No. Those that know each other well and communicate to each other well at all time. And that makes a dynamic, that makes a whole difference. So if this weekend we work all together like football players, communicating, knowing each other, learn how to practice together, then I think we can win and come on Sunday night with real new solutions here. So thank you for your attention, and good luck for this weekend for all those that will participate. Thank you.